1. What is the primary neurobiological abnormality associated with schizophrenia? A. Serotonin deficiency. B. Dopamine dysregulation. C. Glutamate overactivity. D. Acetylcholine excess. Answer: dopamine dysregulation. Rationale: schizophrenia is primarily linked to dysregulation of dopamine in areas such as the mesolimbic pathway, which contributes to positive symptoms. Other neurotransmitters like serotonin and glutamate also play a role but are secondary to dopamine in this context. 2. Which of the following is a positive symptom of schizophrenia? A. Apathy. B. Delusions. C. Anhedonia. D. Flattened effect. Answer: delusions. Rationale: positive symptoms of schizophrenia include delusions, hallucinations, and disorganized thinking. Apathy, anhedonia, and flattened effect are negative symptoms, not positive. 3. According to the DSM-5, how long must symptoms persist for a diagnosis of schizophrenia? A. 1 month. B. 3 months. C. 6 months. D. 12 months. Answer: 6 months. Rationale: for a diagnosis of schizophrenia, the DSM-5 requires at least 6 months of symptoms, including at least 1 month of active phase symptoms. Shorter durations are considered for other conditions like brief psychotic disorder. 4. Which class of medications is primarily used in the treatment of schizophrenia? A. Antidepressants. B. Antipsychotics. C. Benzodiazepines. D. Anticonvulsants. Answer: antipsychotics. Rationale: antipsychotic medications are the first-line treatment for schizophrenia. They help manage both positive and some negative symptoms. Antidepressants, benzodiazepines, and anticonvulsants are not primary treatments for schizophrenia. 5. Which of the following is a common side effect of first-generation antipsychotics? A. Weight gain. B. Tardive dyskinesia. C. Hypertension. D. Hyperglycemia. Answer: tardive dyskinesia. Rationale: first-generation antipsychotics are associated with extrapyramidal symptoms, EPS, such as tardive dyskinesia, which involves involuntary movements. Weight gain, hyperglycemia, and hypertension are more common with second-generation antipsychotics. 6. Which of the following is a typical negative symptom of schizophrenia? A. Hallucinations. B. Disorganized speech. C. Social withdrawal. D. Delusions. Answer: social withdrawal. Rationale: negative symptoms of schizophrenia include social withdrawal, apathy, and anhedonia. Positive symptoms include hallucinations, delusions, and disorganized speech. 7. Which brain structure is most commonly implicated in the pathophysiology of schizophrenia? A. Hippocampus. B. Basal ganglia. C. Prefrontal cortex. D. Temporal lobe. Answer: prefrontal cortex. Rationale: the prefrontal cortex is involved in higher cognitive functions and has been implicated in schizophrenia due to its role in executive functions, working memory, and attention. 8. Which symptom is often observed in patients with schizophrenia that indicates disorganized thinking? A. Flight of ideas. B. Blunted affect. C. Echolalia. D. Loose associations. Answer: loose associations. Rationale: loose associations refer to disconnected, fragmented thoughts, a hallmark of disorganized thinking in schizophrenia. Flight of ideas and echolalia are other manifestations, but not specific to disorganization. 9. What is the most common type of hallucination in patients with schizophrenia? A. Visual. B. Auditory. C. Olfactory. D. Gustatory. Answer: auditory. Rationale: auditory hallucinations are the most common type of hallucination in schizophrenia, where patients hear voices or sounds that others do not. 10. Which of the following best describes a delusion of grandeur in schizophrenia? A. Believing one has special abilities. B. Believing others are plotting against you. C. Believing one is controlled by an outside force. D. Believing one's thoughts are being broadcast. Answer: believing one has special abilities. Rationale: a delusion of grandeur involves the belief that one has exceptional abilities, wealth, or fame. Other options describe persecutory delusions, thought broadcasting, or thought control. 11. Which of the following is the most likely cause of cognitive impairment in schizophrenia? A. Depression. B. Dopamine imbalance. C. Antipsychotic medications. D. Brain structural changes. Answer: brain structural changes. Rationale: cognitive impairment in schizophrenia is often related to structural changes in the brain, such as reduced gray matter. Dopamine imbalance also contributes, but structural changes are a more direct cause. 12. What is the hallmark feature of catatonic schizophrenia? A. Auditory hallucinations. B. Motor immobility or agitation. C. Extreme disorganization. D. Emotional blunting. Answer: motor immobility or agitation. Rationale: catatonia is characterized by abnormal motor behavior, which can involve motor immobility, catalepsy, or excessive movement agitation. 13. What type of antipsychotic medication is most commonly associated with fewer extrapyramidal side effects? A. First-generation antipsychotics. B. Second-generation antipsychotics. C. Benzodiazepines. D. Antidepressants. Answer: second-generation antipsychotics. Rationale: second-generation antipsychotics, atypical, generally have a lower risk of extrapyramidal side effects, such as tremors or rigidity, compared to first-generation antipsychotics. 14. Which side effect is most commonly associated with clozapine, a second-generation antipsychotic? A. Weight loss. B. Agranulocytosis. C. Hypertension. D. Insomnia. Answer: agranulocytosis. Rationale: clozapine is associated with agranulocytosis, a severe reduction in white blood cells. Patients must have regular blood monitoring to detect this rare but serious side effect. 15. What is the first-line pharmacological treatment for acute psychotic episodes in schizophrenia? A. Benzodiazepines. B. First-generation antipsychotics. C. Second-generation antipsychotics. D. Antidepressants. Answer: second-generation antipsychotics. Rationale: second-generation antipsychotics are commonly used as first-line treatment for acute psychotic episodes due to their effectiveness and lower risk of side effects compared to first-generation antipsychotics. 16. Which of the following is a potential complication of long-term schizophrenia treatment? A. Tachycardia. B. Tardive dyskinesia. C. Hypoglycemia. D. Hyperkalemia. Answer: tardive dyskinesia. Rationale: tardive dyskinesia, characterized by involuntary movements, is a serious complication of long-term treatment with antipsychotics, particularly first-generation drugs. 17. What is the primary goal of therapy for schizophrenia? A. Cure the condition. B. Minimize psychotic symptoms. C. Treat underlying neurological causes. D. Prevent comorbid conditions. Answer: minimize psychotic symptoms. Rationale: the primary goal of therapy for schizophrenia is to minimize or eliminate psychotic symptoms, such as hallucinations and delusions, and improve the patient's quality of life. 18. Which of the following is considered a non-pharmacological approach to treating schizophrenia? A. Electroconvulsive therapy, ECT. B. Cognitive behavioral therapy, CBT. C. Antidepressant medications. D. Brain surgery. Answer: cognitive behavioral therapy, CBT. Rationale: CBT is a type of psychotherapy that helps patients with schizophrenia understand and manage their symptoms. Electroconvulsive therapy, ECT, is sometimes used for severe cases, but CBT is considered a first-line non-pharmacological treatment. 19. What is the role of family therapy in the management of schizophrenia? A. To provide a cure for the illness. B. To improve medication adherence. C. To provide emotional support. D. To treat hallucinations. Answer: to improve medication adherence. Rationale: family therapy plays a role in improving medication adherence, educating family members, and providing emotional support, which can help reduce relapses and improve overall outcomes. 20. What is the most effective way to reduce the risk of relapse in schizophrenia? A. Increasing the dose of antipsychotics. B. Avoiding all social interactions. C. Adherence to prescribed medications. D. Resting in a quiet environment. Answer: adherence to prescribed medications. Rationale: adherence to prescribed medications is the most effective way to reduce the risk of relapse in schizophrenia. Non-adherence to medications is a major cause of relapse. 21. What is the main focus of treatment during the prodromal phase of schizophrenia? A. Management of delusions. B. Prevention of relapse. C. Addressing cognitive symptoms. D. Reducing stress and promoting stability. Answer: reducing stress and promoting stability. Rationale: the prodromal phase of schizophrenia focuses on reducing stress, promoting stability, and preventing full-blown psychotic episodes. This phase may involve early intervention to prevent worsening of symptoms. 22. What is the most likely cause of noncompliance in schizophrenia treatment? A. Forgetfulness. B. Medication side effects. C. Lack of understanding about the illness. D. All of the above. Answer: all of the above. Rationale: noncompliance can occur due to forgetfulness, side effects of medications, or a lack of understanding about the illness. Each of these factors can make it difficult for patients to adhere to treatment plans. 23. Which type of schizophrenia is characterized by a predominance of positive symptoms such as delusions and hallucinations? A. Paranoid schizophrenia. B. Disorganized schizophrenia. C. Catatonic schizophrenia. D. Residual schizophrenia. Answer: paranoid schizophrenia. Rationale: paranoid schizophrenia is characterized by the prominence of positive symptoms, such as delusions of persecution or grandeur and auditory hallucinations. 24. Which of the following would be considered a secondary cause of psychosis? A. Schizophrenia. B. Drug-induced psychosis. C. Bipolar disorder. D. Delusional disorder. Answer: drug-induced psychosis. Rationale: drug-induced psychosis can occur due to substances such as hallucinogens, alcohol, or stimulants. Schizophrenia is a primary cause, while drug use can lead to secondary psychosis. 25. In schizophrenia, which of the following neurotransmitter systems is most commonly implicated in the pathophysiology? A. GABAergic system. B. Serotonergic system. C. Dopaminergic system. D. Cholinergic system. Answer: dopaminergic system. Rationale: the dopaminergic system, particularly the mesolimbic and mesocortical pathways, is most commonly implicated in schizophrenia's pathophysiology. 26. Which of the following is not a common early sign of schizophrenia? A. Social withdrawal. B. Difficulty concentrating. C. Hallucinations. D. Decreased motivation. Answer: hallucinations. Rationale: hallucinations typically occur later in the illness. Early signs include social withdrawal, difficulty concentrating, and decreased motivation. 27. Which of the following is an example of a first-generation antipsychotic medication? A. Olanzapine. B. Risperidone. C. Haloperidol. D. Clozapine. Answer: haloperidol. Rationale: haloperidol is a first-generation antipsychotic. Olanzapine, risperidone, and clozapine are second-generation, atypical, antipsychotics. 28. Which of the following is a key challenge in the long-term management of schizophrenia? A. Finding a cure. B. Managing cognitive symptoms. C. Preventing hospitalization. D. Managing side effects of medication. Answer: managing side effects of medication. Rationale: managing side effects of antipsychotic medications is a key challenge in long-term treatment of schizophrenia. Cognitive symptoms and relapse prevention are also important, but managing side effects is critical for adherence. 29. Which of the following is a potential adverse effect of antipsychotic medications? A. Weight gain. B. Hypotension. C. Bradycardia. D. Hyperkalemia. Answer: weight gain. Rationale: weight gain is a common side effect of second-generation antipsychotics, like olanzapine and clozapine, while first-generation antipsychotics can cause extrapyramidal symptoms. 30. Which of the following behaviors might indicate that a patient with schizophrenia is experiencing a relapse? A. Increased social interaction. B. Increased adherence to medications. C. Decreased communication and increased withdrawal. D. Improved self-care. Answer: decreased communication and increased withdrawal. Rationale: a relapse may be indicated by decreased communication, withdrawal, and a return of positive symptoms like delusions and hallucinations. Increased social interaction or adherence to medications would suggest improvement. 31. What is the most appropriate nursing intervention when a patient with schizophrenia is exhibiting signs of agitation? A. Provide a quiet environment. B. Encourage socialization. C. Increase stimuli. D. Avoid physical touch. Answer: provide a quiet environment. Rationale: providing a calm and quiet environment helps reduce stimuli and anxiety, which may alleviate agitation in patients with schizophrenia. 32. Which of the following is the most important aspect of nursing care for a patient on antipsychotic medications? A. Assessing for auditory hallucinations. B. Teaching coping strategies. C. Monitoring for side effects. D. Promoting physical exercise. Answer: monitoring for side effects. Rationale: monitoring for side effects is crucial when patients are on antipsychotic medications, as these medications can cause serious adverse effects such as tardive dyskinesia or metabolic syndrome. 33. A nurse is educating a family member of a patient with schizophrenia about medication adherence. What should the nurse emphasize? A. Medications should be stopped when symptoms improve. B. Medication adherence is critical to prevent relapse. C. Stopping medications will prevent side effects. D. Medications should only be taken if the patient feels unwell. Answer: medication adherence is critical to prevent relapse. Rationale: adherence to prescribed medications is essential to managing schizophrenia and preventing relapse. Stopping medications prematurely can lead to worsening of symptoms. 34. Which of the following is a characteristic feature of paranoid schizophrenia? A. Disorganized speech. B. Delusions of persecution. C. Catatonia. D. Blunted affect. Answer: delusions of persecution. Rationale: paranoid schizophrenia is characterized by delusions of persecution, where the individual believes they are being targeted or conspired against. 35. A nurse is caring for a patient with schizophrenia who is experiencing auditory hallucinations. Which of the following is an appropriate intervention? A. Ignore the hallucinations. B. Dispute the hallucinations. C. Offer reassurance and acknowledge the experience. D. Encourage the patient to act on the hallucinations. Answer: offer reassurance and acknowledge the experience. Rationale: offering reassurance and acknowledging the hallucinations can help the patient feel supported while managing their symptoms. Disputing the hallucinations or ignoring them is not helpful. 36. What is the priority intervention for a patient with schizophrenia who is demonstrating signs of command hallucinations? A. Engage the patient in a conversation about the hallucination. B. Offer medications for anxiety. C. Ensure the safety of the patient and others. D. Encourage the patient to rest. Answer: ensure the safety of the patient and others. Rationale: the priority in cases of command hallucinations is safety, as the patient may act on the hallucinations. Other interventions can follow once safety is ensured. 37. Which of the following behaviors would most likely suggest that a patient with schizophrenia is not responding well to treatment? A. Exhibiting self-care behaviors. B. Expressing feelings of hopelessness. C. Showing improved cognitive functioning. D. Demonstrating social withdrawal and lack of motivation. Answer: demonstrating social withdrawal and lack of motivation. Rationale: social withdrawal and lack of motivation are signs that the patient may not be responding well to treatment, as these are common negative symptoms of schizophrenia. 38. What is the primary focus of cognitive behavioral therapy, CBT, in the treatment of schizophrenia? A. To challenge delusional thoughts. B. To help improve medication adherence. C. To teach coping strategies for stress. D. To provide a cure for the disorder. Answer: to challenge delusional thoughts. Rationale: CBT for schizophrenia focuses on helping the patient identify and challenge delusional or irrational thoughts, thereby reducing the intensity of symptoms. 39. A patient with schizophrenia is being discharged and prescribed a second-generation antipsychotic. What should the nurse instruct the patient about the medication? A. You should take this medication only during an episode of psychosis. B. This medication may cause weight gain and metabolic changes. C. You should stop the medication if you feel better. D. This medication is a cure for schizophrenia. Answer. This medication may cause weight gain and metabolic changes. Rationale. Second-generation antipsychotics are associated with weight gain and metabolic changes, so it is important to inform the patient of these potential side effects. 40. Which of the following is a common side effect of long-term use of first-generation antipsychotic medications? A. Hyperglycemia. B. Tardive dyskinesia. C. Decreased libido. D. Increased appetite. Answer. Tardive dyskinesia. Rationale. Tardive dyskinesia is a common long-term side effect of first-generation antipsychotics, characterized by involuntary movements such as facial grimacing and lip smacking. 41. What is a common characteristic of the cognitive symptoms of schizophrenia? A. Hallucinations. B. Impaired attention and memory. C. Disorganized speech. D. Mood swings. Answer. Impaired attention and memory. Rationale. Cognitive symptoms of schizophrenia, such as impaired attention and memory, often impair daily functioning and are a significant aspect of the illness. 42. What is the main difference between first-generation and second-generation antipsychotics? A. First-generation antipsychotics are more effective in treating positive symptoms. B. Second-generation antipsychotics have fewer side effects. C. First-generation antipsychotics are less expensive. D. Second-generation antipsychotics are more likely to cause tardive dyskinesia. Answer. Second-generation antipsychotics have fewer side effects. Rationale. Second-generation antipsychotics are typically preferred due to their lower risk of extrapyramidal side effects compared to first-generation antipsychotics. 43. Which of the following is an example of a positive symptom of schizophrenia? A. Apathy. B. Delusions. C. Social withdrawal. D. Flattened affect. Answer. Delusions. Rationale. Positive symptoms of schizophrenia include delusions, hallucinations, and disorganized speech or behavior, whereas negative symptoms include apathy, social withdrawal, and flattened affect. 44. What should a nurse do if a patient with schizophrenia expresses that they are hearing voices telling them to harm themselves? A. Ignore the statement and continue with the assessment. B. Ask the patient to describe the voices in detail. C. Stay calm and immediately ensure the patient's safety. D. Tell the patient that the voices are not real. Answer. Stay calm and immediately ensure the patient's safety. Rationale. Safety is the priority in this situation, and the nurse must remain calm and ensure that the patient is not at risk of self-harm or harming others. 45. What is an important consideration when prescribing antipsychotic medication to a patient with schizophrenia? A. Antipsychotics are curative for schizophrenia. B. Medications should be adjusted based on the patient's weight. C. The patient's cultural beliefs may affect medication adherence. D. Antipsychotic medications should be discontinued after symptoms resolve. Answer. The patient's cultural beliefs may affect medication adherence. Rationale. It is important to consider the patient's cultural beliefs and values when prescribing medications, as these factors may impact their willingness to adhere to the treatment regimen. 46. Which of the following is a common side effect of second-generation antipsychotics? A. Extrapyramidal symptoms. B. Weight gain and metabolic syndrome. C. Orthostatic hypotension. D. Tardive dyskinesia. Answer. Weight gain and metabolic syndrome. Rationale. Second-generation antipsychotics are often associated with weight gain and metabolic changes, including diabetes and high cholesterol. 47. Which of the following should a nurse monitor for in a patient taking clozapine, a second-generation antipsychotic? A. Weight loss. B. Decreased white blood cell count. C. Hyperactivity. D. Increased blood pressure. Answer: decreased white blood cell count. Rationale: clozapine is associated with a risk of agranulocytosis, a condition characterized by a decrease in white blood cells, which can lead to serious infections. 48. What should a nurse encourage a patient with schizophrenia to do to help manage auditory hallucinations? A. Focus on the voices and engage in conversation. B. Dispute the content of the voices. C. Engage in activities to distract from the voices. D. Ignore the voices and deny their reality. Answer: engage in activities to distract from the voices. Rationale: engaging in activities like listening to music or focusing on a task can help distract the patient from the hallucinations, which may reduce their distress. 49. A patient with schizophrenia is exhibiting catatonic behavior, such as remaining in a rigid position for hours. Which of the following interventions is most appropriate? A. Encourage the patient to move around. B. Provide a safe and quiet environment. C. Use restraints to prevent harm. D. Administer antipsychotic medication immediately. Answer: provide a safe and quiet environment. Rationale: providing a calm, safe environment is important for patients experiencing catatonia, and medication or other interventions may be needed once the patient is stabilized. 50. When discussing the prognosis of schizophrenia with a family, what should the nurse emphasize? A. Schizophrenia is a temporary condition. B. Medication and therapy can help manage symptoms. C. The condition can always be cured with treatment. D. Schizophrenia always results in complete disability. Answer: medication and therapy can help manage symptoms. Rationale: schizophrenia is a chronic condition, but with appropriate treatment, including medication and therapy, symptoms can be managed and many patients can lead fulfilling lives. 51. Which of the following is most likely to be a symptom of schizophrenia in a newly diagnosed patient? A. Mania. B. Hallucinations. C. Agitation. D. Seizures. Answer: hallucinations. Rationale: hallucinations, particularly auditory, are common positive symptoms of schizophrenia and often present early in the course of the illness. 52. What is the primary goal of treatment for schizophrenia? A. Cure the disorder. B. Reduce symptoms and improve functioning. C. Prevent cognitive decline. D. Eliminate all side effects of medication. Answer: reduce symptoms and improve functioning. Rationale: the primary goal of treatment is symptom reduction and functional improvement, as schizophrenia is a chronic illness with no known cure. 53. Which of the following nursing interventions is most appropriate for a patient with schizophrenia who is exhibiting paranoid delusions? A. Argue with the patient to dispel the delusions. B. Encourage the patient to discuss the delusions. C. Reinforce reality and avoid supporting the delusions. D. Ignore the patient's delusions. Answer: reinforce reality and avoid supporting the delusions. Rationale: reinforcing reality helps the patient differentiate between delusions and reality, while avoiding supporting or arguing against delusions may reduce frustration. 54. What is the most effective intervention for a patient experiencing a relapse of schizophrenia symptoms? A. Discontinue medications immediately. B. Administer a higher dose of antipsychotic medication. C. Continue current treatment and address stressors. D. Increase physical activity. Answer: continue current treatment and address stressors. Rationale: continuing treatment while addressing any stressors or triggers is crucial during a relapse, as medication adjustments may also be necessary, but abrupt changes are not advised without a healthcare provider's consultation. 55. Which of the following is a major side effect of first-generation antipsychotics that patients should be educated about? A. Hypertension. B. Tardive dyskinesia. C. Diabetes. D. Weight loss. Answer: tardive dyskinesia. Rationale: tardive dyskinesia is a serious, irreversible movement disorder often associated with long-term use of first-generation antipsychotics. 56. A patient with schizophrenia is prescribed risperidone, a second-generation antipsychotic. What should the nurse monitor closely for? A. Weight gain and metabolic changes. B. Increased levels of consciousness. C. Excessive sweating. D. Memory loss. Answer: weight gain and metabolic changes. Rationale: risperidone, like other second-generation antipsychotics, is associated with weight gain and metabolic side effects, including diabetes and hyperlipidemia. 57. Which of the following is most likely to improve the long-term prognosis for a patient with schizophrenia? A. Adherence to prescribed medication. B. Isolation from other people. C. Avoidance of psychotherapy. D. Lack of family support. Answer: adherence to prescribed medication. Rationale: adherence to prescribed medication is the most significant factor in managing schizophrenia and improving long-term outcomes. 58. A patient with schizophrenia expresses fears that others are trying to harm them. What is the most therapeutic response? A. You're just imagining things. No one is trying to harm you. B. That must be really frightening for you. C. You're being paranoid and you need to stop thinking like that. D. It's not possible for anyone to harm you. Answer: that must be really frightening for you. Rationale: acknowledging the patient's feelings helps them feel heard and understood, which can reduce anxiety and encourage trust. 59. Which of the following would be an example of a negative symptom of schizophrenia? A. Auditory hallucinations. B. Disorganized speech. C. Lack of motivation. D. Delusions of grandeur. Answer: lack of motivation. Rationale: negative symptoms such as lack of motivation, social withdrawal, and blunted affect significantly impact a patient's ability to function. 60. A nurse is discussing discharge instructions with a patient who has schizophrenia. Which of the following should the nurse emphasize? A. You may stop your medication if you feel better. B. If you start experiencing symptoms again, contact your healthcare provider immediately. C. Avoid talking about your illness to others. D. It is best to stay in isolation to avoid stress. Answer: if you start experiencing symptoms again, contact your healthcare provider immediately. Rationale: early intervention when symptoms recur can prevent relapse or worsening of the illness. 61. Which of the following is the primary goal of cognitive behavioral therapy, CBT, in schizophrenia treatment? A. To eliminate all delusions and hallucinations. B. To teach patients how to challenge and manage symptoms. C. To provide a cure for the disorder. D. To reduce the need for medication. Answer: to teach patients how to challenge and manage symptoms. Rationale: CBT helps patients with schizophrenia challenge irrational thoughts and manage symptoms more effectively, though it does not eliminate them. 62. Which of the following behaviors is associated with the negative symptoms of schizophrenia? A. Increased activity and restlessness. B. Disorganized speech. C. Lack of emotional expression. D. Grandiose delusions. Answer: lack of emotional expression. Rationale: negative symptoms include affective flattening, such as a lack of emotional expression and social withdrawal. 63. What is the primary concern when a patient with schizophrenia begins to display severe catatonia? A. Risk of self-harm or harm to others. B. Dehydration and malnutrition. C. Disinterest in surroundings. D. Decreased level of consciousness. Answer: risk of self-harm or harm to others. Rationale: catatonia can cause immobility or extreme agitation, both of which may lead to physical harm if not managed properly. 64. Which of the following is a common side effect of second-generation antipsychotics like olanzapine? A. Weight gain. B. Acute dystonia. C. Seizures. D. Decreased heart rate. Answer: weight gain. Rationale: olanzapine, a second-generation antipsychotic, is commonly associated with weight gain, metabolic changes, and diabetes. 65. Which of the following is a feature of cognitive symptoms in schizophrenia? A. Auditory hallucinations. B. Impaired executive function. C. Paranoid delusions. D. Disorganized behavior. Answer: impaired executive function. Rationale: cognitive symptoms, such as impaired executive functioning, attention, and memory, are common in schizophrenia and impact daily life. 66. A nurse is caring for a patient with schizophrenia who is displaying poor personal hygiene. What is the best approach? A. Ignore the behavior as it's not important. B. Tell the patient that hygiene is a priority. C. Provide assistance with hygiene and encourage participation. D. Criticize the patient for poor hygiene. Answer. Provide assistance with hygiene and encourage participation. Rationale. Patients with schizophrenia may need help with self-care tasks. Providing support and encouraging independence is key. 67. A patient with schizophrenia expresses that they are receiving messages through the television. What type of delusion is this? A. Persecutory delusion. B. Grandeur delusion. C. Referential delusion. D. Erotomanic delusion. Answer. Referential delusion. Rationale. Referential delusions occur when a person believes that common elements of the environment, such as television shows, are directly related to them. 68. A nurse is planning care for a patient with schizophrenia. What is an important consideration for this patient's care? A. The patient's behavior should be ignored to avoid reinforcing it. B. The nurse should provide clear, concise communication. C. The patient should be encouraged to engage in complex decision-making. D. The patient should not be allowed to participate in care decisions. Answer. The nurse should provide clear, concise communication. Rationale. Patients with schizophrenia may have difficulty processing information, so clear and simple communication is essential. 69. What is a common challenge when treating schizophrenia with medication? A. Difficulty achieving complete symptom resolution. B. The need for continuous psychotherapy. C. The inability to tolerate side effects of medications. D. The rapid onset of medication effects. Answer. Difficulty achieving complete symptom resolution. Rationale. While antipsychotic medications help manage symptoms, they often do not completely eliminate them, and managing side effects can be challenging. 70. Which of the following is the most appropriate nursing intervention for a patient experiencing auditory hallucinations? A. Ignore the patient's hallucinations. B. Tell the patient that their hallucinations are not real. C. Engage the patient in a reality-based conversation. D. Remind the patient to ignore the voices. Answer. Engage the patient in a reality-based conversation. Rationale. Engaging the patient in reality-based interactions can help reduce distress and distract from the hallucinations. 71. What is a key factor in assessing the severity of schizophrenia symptoms? A. Blood pressure levels. B. The patient's level of cognitive functioning. C. The presence of hallucinations only. D. The frequency of episodes of mania. Answer. The patient's level of cognitive functioning. Rationale. Cognitive impairment is a key aspect in evaluating schizophrenia's severity, as it affects daily functioning and quality of life. 72. Which of the following is an example of a positive symptom of schizophrenia? A. Apathy. B. Catatonia. C. Hallucinations. D. Flattened effect. Answer. Hallucinations. Rationale. Positive symptoms like hallucinations, delusions, and disorganized thinking are classic signs of schizophrenia, whereas negative symptoms include apathy and flattened effect. 73. A patient with schizophrenia is displaying disorganized speech. Which of the following should the nurse do? A. Ignore the speech patterns. B. Redirect the conversation to a simpler topic. C. Engage in a debate to challenge the speech. D. Leave the patient alone to calm down. Answer. Redirect the conversation to a simpler topic. Rationale. Disorganized speech can make communication difficult, so simplifying the conversation helps facilitate better understanding and reduce frustration. 74. Which of the following is considered a risk factor for schizophrenia? A. High socioeconomic status. B. Family history of the disorder. C. Low education level. D. Gender, female. Answer. Family history of the disorder. Rationale. Genetics play a major role in the development of schizophrenia, and having a family history increases the risk of developing the disorder. 75. A patient with schizophrenia is at risk for medication non-adherence. Which of the following is the most effective strategy to improve adherence? A. Provide a daily reminder to take medication. B. Educate the patient on the importance of medication. C. Use a long-acting injectable antipsychotic. D. It's only offer medication when symptoms appear. Answer. Use a long-acting injectable antipsychotic. Rationale. Long-acting injectables ensure that medication is administered consistently, improving adherence in patients who struggle with daily oral medication. 76. Which symptom would a nurse consider indicative of a relapse in a patient with schizophrenia? A. Increased social engagement. B. Reduced medication side effects. C. Onset of delusions or hallucinations. D. Normal sleep patterns. Answer. Onset of delusions or hallucinations. Rationale. Relapse is typically marked by a return of positive symptoms, including delusions, hallucinations, or disorganized thoughts. 77. Which of the following types of antipsychotic medications is most commonly prescribed for schizophrenia? A. Tricyclic antidepressants. B. First-generation antipsychotics. C. Second-generation antipsychotics. D. Benzodiazepines. Answer. Second-generation antipsychotics. Rationale. Second-generation antipsychotics, such as risperidone and olanzapine, are preferred due to their more favorable side effect profile compared to first-generation antipsychotics. 78. What is the most important aspect of nursing care when a patient with schizophrenia is experiencing command hallucinations? A. Redirect the patient to avoid the hallucination. B. Focus on reassuring the patient that the hallucination is not real. C. Ensure that the patient is in a safe environment. D. Challenge the patient to ignore the voices. Answer. Ensure that the patient is in a safe environment. Rationale. Command hallucinations can lead to harm if the patient acts on them. Ensuring safety and preventing self-harm is the top priority. 79. Which of the following interventions is appropriate for a patient experiencing severe paranoia in schizophrenia? A. Tell the patient to ignore their delusions. B. Engage in logical discussions to convince the patient their beliefs are false. C. Provide a calm, non-threatening environment and avoid reinforcing the delusion. D. Argue with the patient to break the delusion. Answer. Provide a calm, non-threatening environment and avoid reinforcing the delusion. Rationale. A calm environment helps reduce paranoia, and avoiding confrontation or reinforcement of the delusion prevents escalation. 80. A patient with schizophrenia presents with difficulty concentrating and poor short-term memory. These symptoms are indicative of A. Cognitive symptoms of schizophrenia. B. Positive symptoms of schizophrenia. C. Negative symptoms of schizophrenia. D. Acute withdrawal from medication. Answer. Cognitive symptoms of schizophrenia. Rationale. Cognitive symptoms, such as poor memory and concentration, affect the patient's ability to function and are a significant challenge in managing schizophrenia.